Okay, ladies and gentlemen, let's go ahead and call the Joint Insurance Task Force Committee hearing to order. And as always, the chair thanks each and every one of you for being here. I know how busy everybody is, especially this time of year. Do we have anybody on Zoom? Chris, and who else?
Yes, I'm on Zoom.
Okay, hey, Chris. And he's the only one? Okay. Some brief house cleaning matters. Let's, on behalf of the committee, I would like to congratulate Bert, who was recently appointed as the permanent executive director for the state health insurance plans. Let's give him a round of applause. Congratulations, Bert. Are you sure you want this job? Now, you'll do a great job. Anything that we can do to help you, please don't hesitate to call us. Secondly, if you remember, I gave a shout out to Walter's committee secretary, Deborah, during the last meeting. I want to take this opportunity to give a shout out to the legal counsel for the House Insurance Committee, Miss Erin. Miss Erin, stand up. Not only is she the legal counsel for the committee, but some of you may know that whenever we're out of session, there is no committee assistant for the House Insurance Committee. So she does all of the copying, research, everything. So Erin, thank you for what you do. Okay, we do not have any witnesses for this meeting. I have spoken to Chairman Michelle, and I think that we will try to have one more committee hearing prior to the commencement of the session. And for the benefit of the members, that's going to basically be a recap of the evidence and the testimony that was introduced so that we can maybe promulgate and come up with a draft for the report to submit, if not before the session, during the session. So we'll decide on that date and make sure you get as much notice as possible. Okay, what we have done is, since we don't have any witnesses, we have tried to get a cost analysis of what Mississippi is paying for drugs compared to what other states are paying. And some of you may know that California, one of the biggest states, if not the biggest state by population, is making some changes to their state health insurance plan. And Erin, for the last maybe week to 2 weeks, has been in contact with several members of, I believe, the California legislature and some members of a couple of the companies that will be providing services to California. One of them is actually run by Mark Cuban. Is that correct, Erin? And what's the name of Mark Cuban's company? Cost Plus Drug. And the other company that California will be using, I believe, is Amazon. And that's going to be actually for the delivery of the prescriptions?
Yes, sir.
Okay. Erin, if you don't mind, help us out here and just tell us, we've got two exhibits. Exhibit 1 is from California. Exhibit 2 is from Mississippi. And we did our best, ladies and gentlemen, to make sure that we were comparing apples to apples and oranges to oranges. So I believe we have a common list of drugs, maybe 12 to 15, that Erin will go over and will give you the average of what California is paying compared to Mississippi. Thank you, Erin.
Hey, everybody. So what you're going to be looking at is Exhibit 1 and Exhibit 2. Make sure your Exhibit 1 is the one with the blue at the top. It's the most updated version. And so what I will do is kind of go through, and there are several drugs, 16 to be in fact, on the second page of Exhibit 2 that California also has in their pricing model. Now, this came from the Cost Plus Drugs company. So the columns that I'm going to be referring to are going to be the second column called label, And then the next to the last column called price transparency manufacturing cost. So if you look at the very last page, it kind of gives you a definition of what that is. To the best of my knowledge, it's just the cost per unit for the prescription. And so I'm going to compare that to the net cost per prescription on the Mississippi list, page 2. So the first one, instead of trying to pronounce these drug names, I'm just going to refer to their current rank. So if you look at the first one, number 4, that we have in common is in Mississippi, the net cost is 2 cents. So if you turn to page if you turn to page 11 in your legal sheets, there are several different milligrams that are listed for what the California prices are, and they range from 1 cent to 5 cents. So it's about the same. If you look at the very next one, number 5, it is 53 cents is the net cost per prescription in Mississippi. If you look at that on page 14 of your legal sheets, the price there in California for the cost plus drugs ranges from 4 cents to 10 cents per unit. The next one is number 6 in the current rank, and it is on it's on the same page that you're on, 14. And in Mississippi, that is 6 cents is the net cost per prescription. And in California, that ranges from 1 cent to 5 cents. Now, the next one that we have is the current rank is number 8 on the Mississippi sheet. In Mississippi, that is 61 cents. And if you turn to page 14, that ranges from 3 cents to 9 cents.
Because we don't have the dosage, correct?
Right.
So we don't know exactly.
Right.
Which- okay.
We don't have the specific milligrams. Also, some of the abbreviations are unclear from the California pricing model. So I just did a range of the lowest to the highest. It's going to be in there somewhere. Okay, the next one is number 9. In Mississippi, that net cost per prescription is $13.33. And if you look on page 3 in the legal sheets, that ranges in the California pricing model from 3 cents to 7 cents per unit. The next one is number 10. In Mississippi, it is the net cost per prescription is 30 cents. And in California, that is on page 8, and it ranges from 2 cents to 4 cents. The next one I've got is current rank is 11. In Mississippi, that's $1.61 per unit. And the California pricing model has that listed at 84 cents per unit. The next one is number 12. It is $4.42 is the cost per unit in Mississippi. And in California, that ranges from 3 cents to 8 cents per unit. The next one is number 15 in the current rank. And it, let's see. In Mississippi, it's 1 cent per unit. And in California, it is on page 14, and it ranges from 1 cent to 2 cents. The next one is number 17. It is 8 cents in Mississippi, and the range in California is between 4 cents and 5 cents, and that's also on page 14. Number 18 is $16.56 is the net cost per prescription in Mississippi. And in the California pricing model, that is on page 9. It ranges from 6 cents to $44.64. There are several different milligrams in that one. Number 19 is the next one. In Mississippi, that's 16 cents per unit. And in California, that is between 2 cents and 3 cents per unit is the range. And that's on page 19. The next one is number 21 in the current rank. It is currently 11 cents is the net cost per prescription in Mississippi. And in California, it's between 2 cents and 3 cents. And that is on page 10. The next one is number 22. It is 11 cents in Mississippi. And in California, the range is on page 5, and it's between 2 cents and 3 cents. The next one is number 23 is the current rank. It is $1.83 is the net purse cost of prescription in Mississippi. And in California, it's between 5 cents and 93 cents. And that is going to be on page close to the back. Page 21. And then the last one that we have a similarity with on this chart is number 25. The net cost per prescription in Mississippi is $2.96. And in California, it is between 2 cents and 19 cents. And that is on page 10. That's all of them.
Thank you, Aaron. Bert, I wanted to make sure that the information we provided, we were comparing apples to apples and oranges to oranges. Does it look that way to you? Did you see anything that may catch your attention? We don't know what the dosage is from California, so that's kind of why we provided the range, but they've got the exact same names. And we don't expect you to. We didn't give this to you in advance. You get it at the same time that we did. Now, Aaron, for the benefit of the members of the committee, California is using the same vendor, correct? CVS for their specialty drugs?
Yes, sir. Yes, they
Okay.
use CVS Caremark for their specialty pharmacy services for members with complex conditions, which will include education and high-touch patient support. But it's not the state of California, it's Blue Shield is in California is going to that pricing model.
Okay, and one would suspect that the price that California pays, Bert, under their plan would be less because they have a greater purchasing power, right? However, they're using the exact same PBM. So that leads one to question, and we've got counsel for the Senate committee. Is there anything that would prohibit the state of Mississippi from entering into a compact with California, Texas, Florida, any other state to try to even increase our purchasing power now more so that we can stand on equal footing whenever it comes to pricing with these other states? And I'll be happy to pose that question to any members of the committee or the two attorneys. Are you aware of any state prohibition? I'm not. I think if there would be, it would be maybe on the federal level, but I don't see why that would be the case. Aaron, would you agree with co-counsel?
Yes, sir. I don't know of anything. Like I said, it would be on the federal level if there was something. I'd have to do further research to know for sure about that.
Okay. And we have requested CVS to testify. They are willing to talk to us, not on the record, but off the record on an individual basis, if anybody wants to take that opportunity and speak to CVS. Any input or comments from the committee members?
I do have a question related to just for the state of Mississippi. Is it our PBM that we sign a contract with as a state health insurance plan? We sign a contract with our PBM and that's how these prices are set. So it's the board that has the authority to sign that contract on behalf of the plan. And that's who sets the prices is the PBM. So your point, Mr. Chairman, is the same, the buying power that is used in the larger states. Could we piggyback off of that and try to lower some of these individual prices? Yeah, okay,
I'm sorry. Yes, absolutely.
okay.
Bert, do you have any input or? Yes, sir.
I have a quick question. So, and maybe y'all said this already, but cost plus as far as California is concerned, is this their equivalent to our PBM, CVS? What is their role in reducing these prices or negotiating these prices?
Mr.
You recognize?
Okay, so the way that Blue Shield is gonna set it up in California is they're actually gonna be working with 5 different companies. Cost Plus is gonna be the company that sets the pricing model. Amazon Pharmacy is going to actually deliver the prescriptions. There's another company called, I'm not gonna botch the name, I'll spell it. It's ABARCA. They're gonna pay the prescription drug claims quickly. And then Prime Therapeutics is gonna work with Blue Shield to negotiate savings with their drug manufacturers. And then like the chairman said earlier, CVS Caremark is gonna handle the specialty pharmacy services for members who have complex conditions. So it's actually gonna be all 5 of those companies working together to be their new PBM.
Thank you.
You're welcome.
Mr. Vice Chairman.
Thank you, Mr. Chairman. Thank you, committee. So if we were to allow the state of Mississippi, or if the state of Mississippi can go into an agreement with another state, would we also be opening up the possibility of possibly a municipality and county going in together to get their insurance to save money also?
If they would smart, they would be doing that now through the associations. But yes,
I
that would,
believe there's a law that says the municipalities cannot go in together. So
I'd like to hear more about that. You can go ahead, counsel, you can come up to the table.
Thank you, Mr. Chairman. I think specifically for that question, there's not anything that would prevent them from entering into any agreement with other municipalities. In fact, a lot of different things, insurance, for example, workers' comp insurance, they are all underneath the same umbrella insurance policy. And that's, of course, a different framework, but that's just an example of something like this where they can work together underneath a full policy.
Yes, sir.
other than a trust, and I'll give DeSoto County as an example. You've got 5 municipalities and you've got a county. They're not in a trust. They go and get their individual health insurance. Or will we allow them to say South Haven and Olive Branch go in together to be able to decrease, possibly decrease, or the county and all the municipalities as one to decrease their coverage? price-wise, not coverage.
That specifically is something I don't think I would be aware of. That maybe somebody in this table would have a better answer to that as far as decreasing the price. Or someone in the audience.
That's a good question, but you would think that the logic and the rationale behind grouping everybody together would work at whatever level you're talking about. I just, maybe it's just the fact that they haven't really opened the lines of communication to get everyone on the same page to do it.
Thank you, Mr. Chairman.
Yes, sir.
So I was just going to say, there are laws around association health plans that could be in connection with what you're talking about. And some of those are still being looked at the federal level as to what you can and can't do in putting different employers together. So that may be what you're thinking about. And because there's been a lot of questions coming to the insurance department about association health plans, or can you set them up under what the current laws are and those type things, because those plans do seem to be able to save money when they come together. So I'm just throwing that out there.
Yeah, no, that's very good information. Look, the way I see it is these drug companies, they're not selling these drugs in California at a loss. So why can't we get on the same page and try to get close to the same pricing that they have in some of these larger states? Yes, we don't have the purchasing power, but I mean, and that's a big obstacle, but there's got to be a way that, Mr. Chairman, Vice Chairman, that we can get around that obstacle and save our citizens a lot of money and make pharmaceuticals in the state of Mississippi affordable.
One comment that I have, and I was just talking to Bert about it, is that I found it interesting, y'all know I work at Mississippi College, and one of the most expensive drugs to our plan is Ozempic. And Ozempic is listed here on the Mississippi list in the top 25. It's not even, I can't even find it on the California list. So it was either intentionally left off to not show the amount that they pay for Ozempic, because our state of Mississippi is paying $974.52. Why would Ozempic not be on California's list? Just an observation.
Erin, can you answer that?
So this is the list from the Cost Plus Drugs Company. It's not the entire list of the drugs that they offer. So it's possible that they just won't be the company that's offering that drug. It could be the CVS Caremark if they consider it one of the specialty drugs for complex conditions.
Okay, thank you.
You're welcome.
And just to follow up on the comment I made earlier, I mean, we're taking a hard look at all of this because to my colleagues, I'm sure you're hearing from your teachers back home, just like I am. And Mr. Chairman of Education, I think that's one of the reasons why we actually promulgated and passed this legislation to have this study committee, is that we do our best to give them a substantial pay increase. And then the following year, their premiums go up, which kind of, takes away from the pay increase. So it's a big picture. This is, Erin, I want to thank you on behalf of the committee. This is some very important information. And at the minimum, like I said, we may not be comparing 100% apples to apples, but we do know that these drug companies are not selling these drugs in California at a loss. So again, thank you for your work and we appreciate it. Any other comments or input? Yep, sure, absolutely. You recognize Mr. Chairman.
Thank you, Mr. Chairman. Just to follow up on what you're saying, it's premiums increasing as well as deductibles as well. So that's eating away. If I could, Mr. Chairman, I've asked for feedback from some of my educator groups, from teachers around the state, and they've compiled some list of a document. If I could, I'd like to email it to the members of the committee, just so they can see what the feedback I'm receiving from educator groups, ranging from not covering enough drugs for autistic children to the increases in premiums, deductibles, and so forth, and how it's affected the pay raise that we've given over the last few years is really almost eaten away because the increase in the insurance costs. Some are spending 10 to 15,000 a year in insurance costs, which is greater than their pay raise, you know? So, you know, if I could, that's all I have. I appreciate, I'll get that out to the members of the committee before the end of the week, and that way you'll have it, and then I'll wrap it up when we meet for our final meeting.
Absolutely, if you don't mind. Absolutely, and if you don't mind, provide us a hard copy also at the next meeting. Okay, we don't have a date set yet for the next meeting. It's going to be maybe mostly a recap. I will need your input from each and every member concerning the content of the report. So as soon as we get the date set, we'll get that to you ASAP. And once again, thank you for your attendance, and this committee hearing is hereby adjourned.